In this video, we will discuss ventricular septal defect, the effects produced by the ventricular septal defects, and the fate of the ventricular septal defect. Ventricular septal defect is the most common congenital heart abnormality, and it's a acyanotic heart disease. And what's the most common cyanotic congenital heart abnormality? Tetralogy of Fallot is the most common cyanotic heart disease, and that includes right ventricular hypertrophy, pulmonary stenosis, ventricular septal defect, and air overriding of the aorta. Ventricular septal defect causes left to right shunt, in which there is no cyanosis because oxygenated blood from the left ventricle goes into the right ventricle because the left ventricle has higher pressure than the right ventricle. The blood passes through the defect from the high pressure left ventricle to the right ventricle. Right ventricular overload and overpressure causes right ventricular enlargement. And number 3, overload and overpressure in the pulmonary circuit causes arteriolar thickening in the lung. So when does cyanosis occurs in VSD? VSD is a left to right shunt, acyanotic condition, because oxygenated blood goes to the right side where there is deoxygenated blood. But with time, increase in pulmonary vascular resistance and increased pressure in right ventricle causes reversal of blood flow into the left ventricle. So the shunt becomes right to left. That causes mixing of the deoxygenated blood from the right ventricle to the left ventricle, and from the left ventricle it goes out to the body, and that causes cyanosis, clubbing, and erythropoiesis. This is known as Eisenmenger syndrome when it becomes cyanotic. With what conditions VSD is associated? VSD is associated with fetal alcohol syndrome, mother drinking heavily, Cry-Du-Chat syndrome, and trisomy 13 and trisomy 18. So what's the fate of the ventricular septal defect? Number 1, it may close spontaneously. Number 2, it may cause CCF and death in infancy. And number 3, in adults it causes dyspnea, syncope, chest pain, and hemoptysis. Examination finding: there is a loud P2 and third heart sound because of the increased blood flow between the two ventricles. The murmur: there are two types of murmur in the ventricular septal defect. Number 1, holosystolic murmur at the left lower sternal border, or it may also be heard over third and fourth intercostal spaces. And number 2, a diastolic flowing murmur across the apex. Due to what? Due to increased blood flow through the mitral valve. Which aortic valve abnormality may occur in VSD? Insufficiently developed aortic valve cusp in VSD may prolapse into the ventricular septal defect, leading to aortic regurgitation. So aortic regurgitation may occur in VSD because of insufficiently developed aortic valve cusp that may prolapse into the defect. Murmur is increased on expiration, and the color Doppler shows flow across the defect.